I'm Glenn McGuinness, and this is Outburst. On the program, should the provinces mandate COVID-19 vaccines?
Personally, I think that we should.
I don't think it's right to mandate. I think it's important to encourage it.
You know, the majority cannot force its will on the minority.
Rights and freedoms are well and good, but there are societal obligations.
But first, over the past 2 years, we've all seen how COVID-19 restrictions were put in place, relaxed, and then reinstated once again, much to everyone's chagrin. We all know COVID-19 has been a learning experience, not only for us, but also for those who govern us. But in hindsight, did we loosen the rules too quickly, or should we have kept everything locked down a little bit longer? Our question. Do you feel restrictions were relaxed too soon during the pandemic?
Yes, my own feeling is that the restrictions were definitely relaxed too soon, and we're kind of paying the price now. You can see where the numbers are going, and once again, I would have preferred to have seen an early, hard lockdown.
I'm from BC, from Victoria, and I think that each province kind of did it differently because they have different population density and different factors. So I wouldn't comment on Ontario, Quebec, etc. But in BC, I don't think they relaxed the lockdown too soon and ineffectively. I think they've done a very good job, actually.
I think they did what they could, and the second wave caught everybody. This Omicron really knocked us down. So I don't think they've opened. I think that they're doing the right thing. And that people got to take personal responsibility. You can't make the government do everything for you.
No, they should never have been put in place to begin with, because we would have had, instead of having this giant spike after each restriction, it would have been this steady thing and then naturally eased off long ago.
Yeah, it could be, but that's all part of the empirical process. Let's try this, let's try that, whatever works. Yeah, it could be, but it's all good because it's learning from it.
Depends on what you see in the news. I think it varies by province. Restriction-wise, no, not too soon. People just have to abide by the appropriate behaviors, distancing, mask, and so forth.
No, there shouldn't have been any restrictions. We would have been over it by April of 2020 if they hadn't had restrictions. It's the restrictions that are spreading it out. There's no scientific research that says locking down an airborne virus is possible. All you do is you sequester those who are most vulnerable and let everybody else get herd immunity.
No, you know, we on Vancouver Island were very lucky. I'm from Courtenay. We had very little COVID at the time that the restrictions were ended, so we're very happy. But now our COVID in Courtenay is extraordinary. Where did that come from? Was it because of social contact? Was it because of people coming in from other countries on airplanes?
Or just the holidays.
Yes.
That too many people got together.
Or wintertime.
Or all of it.
Or all of it together.
No, because I think this new variant just came about, so I think, you know, everybody didn't really know what was going to come of the new variant, so I guess we're all doing the best that we can, including those people that are making those decisions for us.
Yeah, I think they were. They should have definitely kept it locked down until we knew that the situation was a little bit more clear, and then obviously keeping restrictions on travel. But definitely could have been a couple more actions taken on that part.
That's hard to say because the virus did mutate, so that's something that no one can control. So, you know, that's hard to say, right?
No, not really, because the new virus that came on all of a sudden. So, I mean, up to that point, I thought we were doing fantastic. So we seemed to be ahead of the game, and everyone seemed to be doing what needed to be done. But now this new one is just after taking off. But I mean, what I see about it and hear about it seems there's no more than a flu. You look back years ago when we had the flu, how many people had the flu at one time? We didn't know those numbers. But now we know every number, just about. So I don't know where it's at or where it's going. I really can't answer those questions. You know, it's hard. We rely on those people who are making those decisions to do what's right, so hopefully they will, and we just abide by it and see where it goes.
I think they have to go with their best judgment, and I'm telling you, I wouldn't want to be the government making all these and the health ministers making these decisions today, you know?
I know that each province has kind of taken their own measures and done, you know, what they felt was appropriate. I think that in Newfoundland we certainly did a lot, and we were in a very good place for a long time. You know, a lot of the time we didn't have any COVID on the island, or we'd only have a few cases that were really isolated. I think we're just in a really hard time now. We have done a lot.
In some areas of the country, yes. I don't think it was too bad here. Most people seemed like they were following what was asked of them, and I think the government did a good job personally.
I think in some parts of Canada, yeah. Not in Newfoundland so much, but I think probably in Ontario, yeah.
Yeah, I think we did because a lot of the ways that happened was following the restrictions. So once everything starts to open, even though health-wise we're not ready to do that, everyone starts going out and we spread again.
Especially during December, I think that's when the pandemic kind of came back a lot because everybody was a little bit more relaxed. It was the holidays, I understand, but especially since we're getting close to the end of January, it's been getting a little bit better, and I just hope everybody will be able to go back to work soon.
I feel like we're approaching our third year of this thing, and there isn't really an end goal anymore, and it feels like the goalposts keep moving further along.
Yes, because the reason being is people take it for granted quickly, and they decide to do their own thing. But if the restrictions are to continue on with some measures, it helps a lot, you know. This gathering of a thing, people like to gather together and have fun smoking and drinking together, and this is the reason why the situation is continuing on and on. But the restrictions should go slowly and slowly till it gets to an end. We shouldn't just rush into it.
Since March of 2020, federal spending, as most of us know, went far beyond what anyone could have predicted, due in large part to assisting people and businesses during the pandemic. The latest inflation numbers were recently put out, and it's not good news. The Consumer Price Index inflated to 4.8% in the month of December, the highest it's been in 30 years, and Canadians are paying more at the till. So, are you satisfied with who's minding the store? Our question. How would you grade the federal government's fiscal management?
I definitely think CERB was a great measure. I support that kind of thing. I know it's a difficult thing because it meant a lot of debt going forward. I wish I had good advice for how to go on, from here on. I do think CERB was a great measure.
Well, the CERB is a very touchy subject. Some people are abusing it, and I guess it's hard to say if it was good or not. I'm sure some people benefited from it. And again, there's some people that just abuse it. So fiscally, I don't know. Who knows? I think it'll be years before we figure out the real problem that it caused.
Well, for me, I would give it a high grade because I'm self-employed and I felt that they kind of gave us support. So I feel like a higher grade, maybe a B, would be where I would give them.
I think it's outrageous. I think what they got done is gone way over and beyond. It's nuts. Where all this money's come from, I'll never understand it. I don't know. There's a lot of people getting paid and you can't get no one to work. I mean, that doesn't make no sense to me at all. But anyway, that's what they're doing, and to me it doesn't seem right. But again, the government seems to think that they're doing right. They're trying to help everybody. Sometimes I think it's just political and it's all about votes. So I don't know where it's going to go, but I think we're paying out too much money for people who don't want to work. I mean, that's one thing I really think is out of reach. Paying kids to stay home doesn't make sense to me.
I think they were stuck between a rock and a hard place. And I think they did as well as anyone else could have done. I know they've been criticized, and anything as big as the government, there's going to be mistakes made. But on the whole, I'd give them a passing grade, and I haven't heard anything better from the naysayers that would actually work. I mean, it's easy enough to criticize. It's a lot harder to come up with a concrete way of going about things.
I think fiscal management is lacking. I think they need to control spending a little bit more than what they've done. I think they've done a pretty good job with COVID, but I think fiscal management is a little bit short.
I guess with the payments that are given to people, they depend on that to survive, so it's a good thing. If they didn't have the government to help, what would they have? Nothing.
I think they did a pretty good job trying to help the people that went out of work and that had a hard time trying to figure out how they're going to get their next paycheck, especially for the people that have been working check to check, and I understand how it feels. And I think they've been doing a pretty decent job compared to some different countries.
My personal position is I would like to one day own a home. Been saving up for a down payment, but if you look at the average price of a home when Justin Trudeau took power, it was around $460,000, and now it's in the $800,000. So the average price of a home's gone up 86% or something crazy like that in the past 8 years.
Well, they spent a lot of money because definitely it was for a good use. You have to preserve your citizens. You have to preserve life. If you tell people not to go to work, stay home, get CERB, get assistance, they spend money buying vaccines, I think it's a good thing. It's better you have the citizens alive than they're dead.
Like B+. I don't agree with everything, but I do understand that it's a pandemic. It's something we haven't really seen before, so I understand that they don't know how to react as well.
The markets went up crazy ever since the pandemic. I remember CERB at the beginning. I think that was very helpful as a student too. I mean, getting that, because we weren't able to work, and even I know there's a COVID benefit, that's very helpful.
It's going to be interesting how it all unfolds. I think we're going to see a huge increase in taxes as we go forward, and it'll be interesting where they come up with all this money that they've invented over the short term. Hopefully we're not paying for it too much.
Oh, it's a complete and utter disaster. Absolute disaster. I've never seen anything so absurd in my life as what they're doing.
I love the intention of it. Unfortunately, I think it got really abused.
Yes.
And then it crippled our economy.
Yeah.
And so people are sitting at home doing nothing, and businesses are crying for staff. So unfortunately, I don't think that part worked. It was a good idea.
Good idea. Absolutely.
I was thankful that there was help available.
Yeah.
I mean, I was actually really proud of our government for that.
Yes. They did handle it well. It just got abused.
Yeah.
I think they did all they could in an extremely difficult situation. It's easy to look in hindsight and criticize. They spent an awful lot of money. But I don't see, with the exception of CERB perhaps having dragged on a bit too long, I don't see that they've squandered money or spent it unnecessarily.
Fiscally, I think he's done an abysmal job. I think he has no idea of economic structure, and he is not helpful to small business in the least. His idea is to tax and spend. He's in bed with the NDP, whose idea is to tax and spend and woo over a voter with money. And so it doesn't work. We're going to be poorer than ever. Our grandchildren will suffer terribly, and I think he's done a very bad job.
I know that I run a small business, and what they provided helped us. It helped us a lot in the one summer where we couldn't operate for half. So I'm assuming that everybody benefited from that. How we're going to come out the other end, I'm not sure. Somebody's got to pay for it somewhere. But it did get us over the hump personally, so I'm grateful for what they put out there.
Which province or territory's name, translated, means Great River? Yukon, Saskatchewan, or Manitoba?
Saskatchewan.
I want to say Manitoba.
I have no idea.
I would say Manitoba.
Yukon, Saskatchewan, or Manitoba?
I want to say Yukon.
Manitoba.
I'm guessing Saskatchewan.
I think Yukon.
You are absolutely right. Very good.
Yukon means Great River in the Gwich'in language. The Yukon River is the longest river in Alaska and Yukon Territory and the 5th largest river in North America. Before the arrival of European settlers in the 18th century, it served to connect an extensive trade network for indigenous communities in the region. It was also one of the principal means of transportation during the Klondike Gold Rush. The Yukon River remains a central component in local indigenous culture, as well as the commercial fishing and tourism industries.
When speaking recently about how Canada's healthcare system is being stretched too thin due to COVID-19, Jean-Yves Duclos, Canada's healthcare minister, suggested the provinces and territories should consider mandating vaccinations. Duclos feels this approach would be vital in ending this pandemic, but not all the provinces are on board. So we took the question to you.
Should the provinces mandate COVID-19 vaccines?
I think so, yes. Rights and freedoms are well and good, but there are societal obligations, and I think that we owe it to one another to be as diligent and as vigilant as we can to protect the interests of each and every one. It's you, it's your family, it's the one next to you. I'm not wearing a mask, I'm out for a walk, it's 0 degrees. I'm not being a hypocrite.
I definitely think that the COVID-19 vaccine should be mandated. I think it really helps the population in general, and it keeps the economy going. We can be more doing things in person, living our lives, and keeping everyone safe at the same time. Yeah, definitely.
I do not think the province should mandate a COVID-19 vaccine. I think it is extremely important that people are able to maintain medical sovereignty.
Yes, I do think they should mandate COVID vaccines, or just for the simple reason that us that have taken it are at risk for the people that don't feel like taking it, and it's not good, these shutdowns. They're not good for the health system or the economy.
I don't think it's right to mandate. I think it's important to encourage it and that sort of thing, but to force someone to take an injection that they're afraid of for whatever reason, I don't think is something that our society should endorse.
Yes, of course. Why? For save your life. You don't know. You don't know your metabolism or how they can react with this COVID. You know, it's like, yeah, we have to. But they don't bother me. Believe me, I'm ready to have the vaccine every 6 months if I have to do every 6 months, or every year if I have to do every year, because we are going to do anything. No travel, no dinner in the restaurant, no activity, no nothing. What do you want? Live in your house?
I think there's a fine line between respecting people's personal freedoms but also getting through this pandemic. I actually think that the provinces and the federal government should focus on vaccine equity with less developed countries, and I think that would actually have a bigger impact preventing new variants arising than focusing on boosters here. But I'm not an expert, so.
No, they shouldn't mandate them. No, because there's certain people that have exemptions, for one thing, and for another thing, it's just something that everybody should eventually be convinced is essential to their well-being and that of everybody else.
At this time, I do feel that they should mandate the COVID-19 vaccines. Yep. Why? I mean, the science is proving that it works. People are still getting it, yes, but they are not getting as sick.
Absolutely not.
Why not?
Because it's my body, my choice.
I don't think so. I think that, not to sound conservative, because I'm not, but like we are like in a free country, and I think people should be free to make their own choices, no matter what that is, really.
No. Well, because we live in a free economy, democracy, the individual rights always, rule. The majority cannot force its will on the minority.
Well, it is an individual decision, and people have their reasonings for not taking it. I don't agree with them, but I think each of us have our own responsibility to do what we choose to do.
Oh, absolutely not. I think people have to have a little freedom. I'm double vaxxed, but I respect people's choice that they make.
I think that in certain areas it probably should be mandated, but I think there's definitely not a black and white answer, in my opinion, for that question.
I am reluctant to mandate it. I would rather that it was made so painful for people not to do it that they did it voluntarily.
No, I think people should have the right to decide if something gets put in their bodies or not. I think if we lose the right to our own bodily autonomy, it's, that's pushing it too far. I think if we want to say that we're free, we should be able to decide what happens, but I think personally the core issue is that we need to be investing more in our medical infrastructure, and I think it's crazy we haven't built another hospital or expanded ICU capacity.
Personally, I think that we should, just because even though I think there's a lot of misinformation about it, first of all, but a lot of people think that the COVID vaccines completely stop or avoid catching the virus, but it's just helping with your symptoms. And there are a lot of people who are saying that they have cold symptoms, but they're showing up negative, and that's just your vaccine doing its work. So I think it's just better for everyone to be able to have their vaccines and to stay safe.
Honestly, I definitely do think so because, like I said, it's been getting bad. I have a lot of family members that have been getting sick lately, and it's just because it'll be a lot easier and it'll be a good way to protect everyone.
I don't think they should mandate it. I don't agree with, like, for example, the Quebec poll tax thing. That's a little bit extreme for my taste. I do believe in the vaccine. I think that people should get it, and it's meant to protect us, right? But I don't think that it should be mandated, no.
As March will mark the second anniversary since this pandemic was declared, we've learned that COVID-19 does not discriminate and affects people on so many levels from all walks of life. So once again, we sent our cameras out to the streets to ask people what imprint COVID-19 has left on their lives. Our question:
how has the pandemic affected you?
You know, I work for an airline, so it's been tough, and you know, I've seen a lot of my friends being laid off. For my family, it's just everybody's stressed. You know, as soon as somebody gets sick, you're like, oh, you know, is it COVID? And you can't see people as much. And I got 2 boys, so it's hard on them too. You know, with school being canceled at home, is it going to be, you know, like, it's just, yeah, it takes a toll, and just tired of talking about it, tired of things reopening, closing. I'm very thankful. You know, I've been here for 24 years, but I grew up in Quebec, I'm sure you can tell. But, you know, I mean, we were thinking about moving back east. Well, and now I'm like, you know, with the mandate and everything, I'm just like, you know, and now they want to tax none. You know, it's just great. Like, I know, it's too much.
Oh, it's had a great effect on everybody. It's just changed the world, and yeah. But you get through it and you try to live your life as best you can.
I think definitely reduce socialization. My family did actually get infected with Omicron over Christmas and New Year's, so we weren't able to spend time with family and holidays. My work has been drastically impacted, so it has had an astronomical effect on me.
I retired recently and had planned to be doing traveling. I'm not doing that. I've got a daughter in Australia, which I can't go and visit. I have a daughter here who has recently just got the Omicron variant. We think she can't get tested, but she's working from home, so she can't do it, but we can't go and visit.
I lost a lot of my shifts at work, so it's hard to make enough money to get by, but, you know, I'm managing.
I mean, when it first started, I was graduating high school, or a year before graduating high school, but I graduated high school during the pandemic, so no prom, no graduation. So it's just really, I mean, all those things that you kind of look forward to as a kid, just kind of halted all those, skipped past them, and feels like time's been going by really quickly ever since.
Well, I'm currently laid off. I've lost track of how many times I've been laid off, and it's pretty unfortunate that there's been multiple months now where I've zero income, or I've been applying for the wrong benefits, and after enough time goes by, it's just I was negligent in trying to find out what benefit I was qualifying for, and it's just annoying. I would love to be able to go back to work and provide for myself.
How I would say it, complicated. It's less freedom. It's just we are stuffed inside the home, afraid to go. Always calculation. There is nothing spontaneous. It kills spontaneity.
Well, getting to go to sporting events. I'm a big sports fan. Restaurants, movies. I know I have to wear the mask, but I really don't enjoy it.
I mean, there's family I haven't seen that I'm very close with for 2 years. Can't travel. Don't want to risk traveling outside of the province too far. And I mean, like everyone, I ride transit. And they do their best, but you know, the numbers, there was a lot of exposures there. So sometimes you feel a little, not unsafe, but you know you're sometimes at a risk. for an exposure. So things like that start to cause some anxiety.
Personally, it's mostly affected the way that I am going to school as a student. It's also affected everyone's social lives and just overall livelihoods, but I think definitely the biggest factor has been the change in the way that people are going to school and learning nowadays. So definitely being a student.
Oh, well, we haven't seen our little granddaughter as much as we would like, and maybe once or twice a year, for one thing. And she's right in Nova Scotia, so, you know, I think that's how it impacted myself and my husband the most.
Just a wide range from everything, whether it's work stress or, you know, being cooped up indoors, not being able to spend time outside, which is something I personally really love to do. So just personally, I'd say just mental fatigue. I think we're almost 2 years into it now, so to say mental fatigue, I think is honestly an understatement.
The pandemic on me, this Christmas, I've spent my Christmas in residence at school. I haven't been able to go back home across Canada to BC. So the pandemic has been very difficult as far as separation from my family and all that.
I'm claustrophobic and being tucked away and isolating and lacking social interaction, social depth. It's been frustrating. What's really frustrating is the fact that I think we could have been through this, and there's about 10% of the population that keep dragging us back. And I'm a little bit bitter towards that fact. That I think it's a miracle. I think it's an absolute miracle that there was a vaccine developed as quickly as it was. And for us to ignore it, and it's like Dr. Fauci said, you know, if this were during the days of polio or tuberculosis, we'd still be fighting polio and tuberculosis because of these fractious groups.
Quite a bit. I mean, I'm in university right now, and I've had almost my entire degree online, which is a big change. But other than that, I'm starting to get used to it. It's the new normal. We're almost 3 years in now. It's kind of hard to see the light at the end of the tunnel, but hopefully it's coming soon.
My job is essentially void because of the pandemic. I worked in nursing homes as a contractor, a non-essential contractor as a music therapist, and I have been unable to work steadily for the last 2 years.
I'm home a lot. I don't see my relatives as much as I'd like to. It's a beautiful day, so I'm out walking. That's a good thing. But we're all doing the best we can. I think that I'm just accepting that it is what it is. And fortunately, I've always been able to work from home, so it hasn't affected me that way. So I feel blessed. But I do feel for people who have to go to work. That's how they make their living. So I can understand that it must be very hard on a lot of people.
Thanks for watching this episode of Outburst on CPAC. If you have any comments about this show or any other show, you can find us on social media. You can also find us on our website at www.cpac.ca. I'm Glenn McGuinness, and on behalf of my colleagues at the Cable Public Affairs Channel, thanks for watching. We'll see you next time.